Good morning and welcome to everyone here at CSIS and those joining us remotely. I'm J. Stephen Morrison. I'm a Senior Vice President here at the Center for Strategic and International Studies, CSIS, here in Washington, D.C., where I direct the Global Health Policy Center. Today we're gathering to focus on accelerating innovation on antimicrobial resistance, with a special focus on the power of the Transatlantic Alliance and the centrality of research and development and all that is needed to make R&D a success upstream, downstream, at home and in other high-income countries and low- and middle-income countries, which carry a massive burden. Today's session is hosted by the CSIS Bipartisan Alliance for Global Health Security, that is co-chaired by former CDC Director Julie Gerberding, former CDC Director and head of the NIH Foundation, Julie Gerberding, and former Senator Richard Burr. Very grateful to them for their leadership and commitment to these issues. A newly created Alliance Working Group on Research and Development has chosen to make AMR a priority. We'll publish a reflection of what transpires today. We'll post the video and transcript, and we'll enlist some experts to do a series of podcasts. That would be in our series, the CSIS, the Common Health. And so please do subscribe to that series if you are a fan of podcasts. I see many reasons to be excited and hopeful, as well as reasons to pause and take a careful look at what's working, what's been accomplished, and what more is needed. It's a right moment of opportunity and reflection. But first, some special thanks to my colleagues who worked tirelessly these past weeks to put the pieces together, Michaela Simoneau, Humza Khan, McLean Spear, and Sophia Hirschfield. Our CSIS production team, Dinesh Makhani, Eric Raditsky, Kiju. And thanks to our partners at the EU, Marco Castellina and Agnieszka Jarmula. The Swedish government's played a really important role in encouraging us to take this up and in helping us pull it all together. Petra Hansen has been particularly central in all of that, as well as Ambassador Karin Olofsdotter and the DCM Ingrid Ask. Patrick Picard from the Canadian Embassy, also very important. One of our alliance members, Duke's Krishna Udayakumar, traveled from Duke to be with us today. Thank you, Krishna. And our panelists who are joining us and giving their time and insights, Colin McGiff, HHS Office of Global Affairs, Linda Rastani from the Public Health Agency of Canada, Ingrid Keller from the EU Health and Food Safety Directorate. We're also joined in our second panel, Wolfgang Philipp from HERA, Swedish Ambassador on AMR, Malin Grape. Thank you, special thanks for making the journey to be with us today. Christopher Hutchins from BARDA. As I indicated, the time is ripe to take another look at AMR with hope and a critical eye. In this post-acute phase of COVID, attention is returning. There's a shared determination to understand what the patterns of regression have been on AMR and what the strategies are to get back to pre-pandemic levels and restore momentum. It's impressive, the strength of interest that we've seen on the part of the EU, Canada, the UK, Western Europe, Scandinavia, and now Japan. A similar energy is seen here in the United States in the Biden administration and interest in Congress. The pool of countries that are elevating AMR to be a priority is expanding. And AMR is steadily becoming a bigger concern among low and lower middle income countries, which brings with it, as we'll hear today in the post-COVID phase, overt concern with timely and affordable access, transparency, and a concern with ensuring the basic capacities, basic capabilities, surveillance, data, laboratories. We're seeing improvements in data, dramatic and historical improvements from IHME, from CDC, from WHO that change fundamentally our understanding of the true scale and scope of AMR, the mortality, the excessive impacts AMR is having in low and middle income countries. Institutions are changing. There are new important institutions coming on the scene. The EU's HERA, Japan's SCARTA. We're coming off of years during COVID when we saw dramatic and rapid gains in generating new technologies in health security There's an enthusiasm that spills over. There are promising products emerging. We'll hear about those in AMR, tied in part to the new funding instruments that have begun to mature. They're not without their problems, and we'll hear about those too. Different innovation models are evolving. We'll hear more about them. The UK is putting its subscription approach into the pilot phase. The Biden administration has introduced into its budget proposals something very akin to the Pasteur Act introduced in Congress. The EU is refining its strategy. We'll hear all about those. Security and geopolitical realities are helping. They're having an impact in some respects. AMR has been overtly incorporated into national security doctrines, certainly here at the United States, but beyond that. And those doctrines recognize that health security is a matter of global security and that AMR has to figure in those recalculations. AMR has become a higher and more visible priority for the Transatlantic Alliance, quite visibly through the actions of the G7 and the TACFAR partnership. In the face of the Russian war against Ukraine, the Transatlantic Alliance has reached a peak of unity, common purpose, and power. It's also opened the way to do more in health security. The Hiroshima Summit leaders' communique contained 3 detailed paragraphs on AMR and many more pages on other areas of health security. A similar geopolitical phenomenon can be seen in Asia, where the U.S. is deepening its alliances with Japan, Australia, the Philippines, South Korea, India, President Modi here this week, and others, and where health security figures in those calculations. We're seeing the opening, for instance, of the CDC regional office in Tokyo, which is directly tied to these sort of this sort of geopolitical environment. A few closing words about here in the environment here in the United States. AMR has remained, fortunately, an area of bipartisan consensus. That's a big asset. The threat is real. The mortality is estimated in the United States to run at between 35,000 and 167,000, but it's not so high as to capture the high-level attention needed and to drive major change. We're not quite yet there. And just compare that with the impacts we're seeing on the opioid crisis in the United States and the attention, the White House summit yesterday on the rollout of Narcan and the like. We know what needs to happen, and we're edging towards higher level action, but we need to be realistic and keep our eyes open. There will be no changes, certainly in the United States approach, without concerted leadership and sustained political will and heightened finance over several years. That won't happen overnight, given our budget constraints, the recent debt ceiling deal, our electoral cycle, and the broader polarization around pandemic preparedness. And we have a problem here in the United States in terms of the turnover of leadership in science and public health at the higher reaches of the U.S. government. But these are all transitional matters, and I think we need to keep our sights on the bigger question, which is how to continue moving forward in positioning AMR to be a higher priority with all of those elements that we've indicated are needed. We need to remain strategic and think long-term. The high-level meeting at the UN General Assembly in the fall of 2024 is another important milestone which we can be pointing towards as we take this long-term and strategic outlook on this. Today we're going to have 2 panels on transatlantic cooperation, on accelerating R&D. We've not put a big focus today on animal and plant health. We fully recognize their central significance, and we'll turn to them in due course in our work in the future. Today, we simply had to make some hard choices within the time limits that we're operating. For the flow here, we'll allow time to hear from those in the audience for the panels. I want to now turn to invite Dr. Julie Gerberding, not Julie Glass, Julie Gerberding to the stage and our panelists for our first session on the power of the transatlantic cooperation. If you come forward, please. Julie's co-chair of the Bipartisan Alliance for Global Health Security. For the past year, she served as CEO of the Foundation for the National Institutes of Health. Her expertise in these issues crosses industry, government, clinical medicine, a decade-long tenure as senior leader at Merck Co, and her leadership of the CDC through several outbreaks during 2 terms of the George W. Bush administration. Thank you all for your patience and for joining us today. Over to you, Julie.
Thank you, Steve. And thank you, everyone, for being here and for joining us online. You know, and I was thinking about preparing for this and how important this topic is. I also had to think back on the fact that I've been an infectious disease clinician for a long time, and this is one of multiple events where I've been on a podium discussing the problem of antimicrobial resistance and what are we going to do about it. And I can't say we haven't made any progress, but the progress has been slow. So I appreciate the opportunity to shine a light on this and to really think about how the transatlantic partnership is positioned well to continue to lead the charge in this area. If you think about it, in 2019, which was the year before the pandemic started, obviously, there were about 5 million associated cases of antimicrobial resistant death globally, and about 1.2 million of those death was directly attributable to the antimicrobial resistant infection, according to the Institute for Health Metrics and Evaluation at UW in Seattle. 1.2 million people dying a year is a pretty big number. And yet I think if you ask most people, they would have no clue that this problem was so ubiquitous and so deadly and so important to so many people in developed and developing countries. So our charge here is serious, and yet science is on our side. We just have to figure out how to harness that science and lead us in the right direction. So with that, I will introduce my panelists. First, sitting here on the podium with me is Colin McGiff. Colin has an incredible portfolio of policy experience, but is currently the Deputy Assistant Secretary in the Office of Global Affairs at HHS. But your long-standing participation in government policy certainly puts you in the upper echelon of policy wonks, I would say, who's had a tremendous impact on a variety of issues throughout his career, which are referenced in his bio. Online, I think you can see we have Linda Rastani, who's the Director of Antimicrobial Resistant Global Engagement and Innovation for Public Health Canada. Linda is also someone with a very long and storied tradition of participating in broad policy experience, and we're very fortunate to have her perspectives represented here today. And last but certainly not least, Ingrid Keller, who is a public health expert, but she has kind of traversed the world of non-communicable, and now finally she saw the light and is in the communicable disease part of policy and public health development as the head of the, sorry, I lost the exact title here, sorry. The head of the health security unit at DG Sante. So just for context, TACFAR, we'll just start with the big picture here. TACFAR, the Transatlantic Task Force on Antimicrobial Resistance, really was started a long time ago in 2009. And I would refer you to read the most recent 5-year report, which really summarizes the accomplishments in the recent years, as well as the strategic plan leading into the next 5 years of TACFAR. But it was started for 3 reasons. First and foremost, to prevent community and hospital-acquired drug-resistant infections. Second, to really improve the appropriate utilization of antimicrobials for human and animal use, so veterinary use is included in the remit there. And then finally, to try to open up the pipeline of innovation and drug discovery for anti-infectives. So Colin, let me start with you, and sort of with that background, how do you think we're doing, and what do you see as the highlights of TACFAR so far?
No, thanks very much, Julie. Thanks very much, and good morning, good afternoon, everyone. Good to be with you all, and glad to be with my colleagues on the panel. I think TACFAR really has been a bright spot in terms of coordination, in terms of this question of the centrality of the transatlantic relationship. The 5 partners, the US, EU, Canada, UK, and Norway, all are implementing these issues in different ways nationally, but there's so much overlap and so much commonality as well that I think it's important. We often get distracted by that 10% or whatever that is of the differences, when in fact that massive amount of commonality is really important. And so I think I guess I would just note up front that for me one of the big benefits of TACFAR has been that it brings this technical foundation, whether it's looking at surveillance issues, harmonization coordination of practices across the different economies, or even looking at issues around communication and messaging to the general public. It brings that technical foundation that has allowed that. I think it's contributed significantly to the way in which AMR has been addressed across multiple administrations. Speaking as an American and as a civil servant, I think it has enabled effective policy on AMR to go across administrations and go between parties and remain that bipartisan approach that Steve was talking about. And so I think that's certainly one significant contribution that it has made. And then I think as we're looking to address some of the challenges, it's also created an opportunity to bring in other partners like Japan in an observer role and other things to try to create more, again, space for collaboration, space for engagement. I think, one of the areas, and I think the next panel will get into this more, but certainly one of the recent areas that we've been talking about and that I think is certainly the challenge is the pipeline and how to create incentives and set it up in such a way that it can actually work. I think folks are aware, and I think the other colleagues will discuss more some of these high-profile situations where a lot has been invested, and in fact the products haven't ultimately. Even if the products themselves are fine, the market hasn't panned out, and so therefore then those products can become lost even after all of that significant investment. So there is a lot of effort on that front, as well as on some of the more I would say technical and communication front. It's a small thing, but the UK musical on AMR, the musical, came to Washington, and there was some collaboration around that to try to create these new ways of communicating the risk. I think, Julie, to your point about the deaths, it's a constant challenge and a constant refrain, I would say, in terms of the overall impact of antimicrobial resistance on human health and frankly human security, and the fact that it is just not resonating in the same way that other public health challenges do and have and continue to over time. And so finding ways, creative ways, and as to address that is something that I would say is another major priority. And I think the last thing I would say is to note that I think it's been a useful policy platform to look ahead to these other, both current active negotiations, such as the Pandemic Accord, but also, as Steve mentioned, the high-level meeting in 2024. How can we do some forward planning for that to once again make sure that the political level actions and statements are actually grounded in science and what will have an impact.
Thank you. Linda, let's turn to you and kind of get the Canadian perspective here. You've heard about the value of the science, the value of the technical foundation for policy. What was it that motivated Canada and you particular to get involved in this? And what is your assessment of the overall value that we've been able to create so far?
Yeah, well, I would agree with everything that Colin has said, and he's addressed many of the issues that we're going to talk about here today. I think TACFAR brings huge value because part of our transatlantic cooperation, I think, needs to be grounded in the technical work that we do together. And so more apolitical multilateral forums like TACFAR are essential. Are essential to that. That said, I do find that oftentimes with the limited amount of time and resources we have to spend in any given week or month, the forums and multilateral engagement mechanisms that have more public visibility, have more political attention, will get more of our time and resources. And so I think TACFAR is important, but elevating the work that we do there and demonstrating results from the work that we do there and our collaboration there is key to continue getting buy-in for us as transatlantic partners to continue working together on this, because I think that being willing and able to collaborate is key, but the able part is tied to resources, and that's something that requires political commitment. So I think that our primary role as transatlantic partners is to keep the momentum and spotlight on AMR. So Canada is very delighted to be part of that community of great partners, many of whom are leaders in the space, and we hope to follow in those footsteps in very many areas. But there's also other opportunities for us to pursue our collaboration and go beyond the transatlantic alliance as well, which I think is important for true global impact.
Thank you. So Ingrid, you have an even bigger challenge because it isn't just one country, you have the whole European Union in your remit. How do you herd those lions, and how do you keep this issue live and relevant in the context of all of the competing priorities that are on everyone's plate right now?
Good morning to you. Thank you, Julie, for your questions. I'm very pleased to be with you today, and I would like to mention first that I'm replacing our director, John Ryan, who unfortunately cannot be with you this afternoon, my time, the morning, your side. Yes, you said it, and I agree with my fellow panelists who are saying that TACFAR is really important to us as well. And I would like to also recall that when we founded TACFAR, it was again under the Swedish presidency, the EU presidency, and we are now again under the Swedish presidency, where a lot of emphasis on AMR is being shed. For example, through a new legal instrument, we call it a council recommendation, and my Swedish colleague will maybe go into a few more details, but this is one of the tools we have to be the shepherd, as Julie was saying, and to herd the flock here and keep the momentum alive. It was surely not easy during COVID. I mean, it would be a lie to not admit that. Where everybody was really focused, rightly so, to fight COVID, and other issues had to step somewhat aside. However, we have now put back on the table AMR a lot through, as I said, the council recommendation, but also we are hosting a physical meeting of TACFAR in November this year here in Luxembourg. So also through the physical meetings, we are really trying to discuss and also reinvigorate our collaboration. Because for us, the 4 work areas that we have been discussing over the past years in TACFAR, looking at antimicrobial use in human and veterinary medicine, also looking at surveillance, also on strategies to improve financial incentives, and also looking at cross-cutting actions. These are all very important for us, and we would like to continue this important collaboration on those 4 points. We have seen that there may be some barriers from colleagues, as Julie was also hinting to, that in the day-to-day work, it is not always clear that we also need to spend time on our more multinational commitments. But we in the EU, we are really trying to cut out some time from our partner countries to make this to work bilaterally and then also with us. COVID has also brought a new health security legal framework to the EU, and within that, AMR has a very, very prominent place. So in that sense, we are confident that we keep AMR here in Europe high on the political agenda. And you have also invited my colleague Wolfgang Philipp from the newly funded Health Emergency Preparedness and Response Authority, who will also describe more in depth than their new work in new ways, how they put very prominently also AMR on the agenda here in Europe. Back to you, Julie.
Thank you. You know, I mean, the themes here are pretty consistent. Our left brain knows this is urgent and important, but our pocketbooks are actually not being opened up to help make the investments that are necessary to really drive the agenda. And we're operating in a context where people are distracted with a lot of other issues that seem closer to top of mind than this one. I'll turn to you, Linda. When you have a chance to speak to decision makers in Canada, how do you explain the urgency to them? Like, what is your pitch, your marketing strategy to help emphasize how important this really is?
Yeah, that's an excellent question. So having just kind of completed this marketing storytelling exercise on our end and having been successful in doing so and getting some new funding through our federal budget in March, I appreciate this question, and we recognize the challenge that it was to tell the story in a way that spoke to the urgency of AMR without, being sensational. It was very important for us to focus on the science and focus on facts and to compare it with other issues that in Canada are getting a significant amount of funding. So comparing it to issues like the opioid crisis and the number of deaths there. In Canada, the number of deaths attributable to AMR, the last time surveyed this, was very comparable and a bit higher actually than the number of opioid-related deaths. So when you bring this to the mind of decision makers and leaders, and then explain AMR in a way that also, makes them understand that we're already behind on taking action. We're already coming to the game a little later than we would all ideally have liked to, right? And show the data and the compounding effect of not taking action on AMR. I think that speaks to leaders. In our case, our minister has our health minister has a strong economic background. And so in our first, briefing on AMR, he was very interested to understand the market failure. Why is industry vacating the market? When we explained the issue to him, both about antimicrobials as a type of drug, but also the things about the Canadian marketplace that are making our market not as favorable to industry. It's easy when you put those things together and make AMR a broader issue than just a public health issue, but a socioeconomic issue, to really generate the right kind of interest and attention. But of course, we would like even more funding. We would like a more permanent and sustainable program. But what we got at a time when, a lot of our nations are dealing with the post-COVID effects on the economic expenditures that have been made to deal with COVID. This was a big success for us that our Canadian government saw the urgency and the need to invest in AMR at this time, despite everything else.
Thank you. And I think in the next panel, we're going to get into this market failure in a bit more detail, but we all know what we mean by market failure, and yet it's not really the market that's failing. we're failing. Science is on our side, but we haven't yet really figured out a comprehensive way to pull these medicines through and accomplish the potential of science in really creating novel strategies for combating infections, and by definition, then antimicrobial resistant infections. So from your perspective in the Department of Health and Human Services, where does this really fit on the agenda of priorities for HHS?
Absolutely. So I would say that this is, thanks very much, Julie, for that. And I think that it is very much a priority for us. I think we recognize that COVID set back the response in a lot of ways. And so indeed, Secretary Becerra asked the Advisory Council on antibiotic-resistant bacteria, the TACFAR, with providing recommendations on how to augment our national preparedness, and so those recommendations are moving forward. I think also, as Steve alluded to, we're tracking very closely the Pasteur Act and hope for its progress to establish a subscription-style model which would offer antibiotic developers an upfront payment in exchange for access to the antibiotics. And then, of course, the President's budget as well in FY23 included a proposal for a novel payment mechanism to stimulate future innovation in antimicrobial products, so while enhancing stewardship of their appropriate use. And I think that so these are different areas where we're trying to address the breakdowns and the failures. And I think it's important, again, and I appreciate something that again, just going back to some of the TACFAR conversations that I've had an opportunity to participate in, I think there's a recognition that our economies, our markets that are represented by the TACFAR membership are super important, no question about it. And of course, getting and keeping innovators in the mix and willing to participate is super important as well. And so coming up with these novel approaches, I think, is key. But recognizing then that there has to be a broader, more global approach as well to access and stewardship approaches, and that both access and stewardship need to really go hand in hand, I think is another big priority for the department and for how we're showing up in places like WHO, G7, G20, and then a high-level meeting and beyond next year.
If you frame AMR as part of an overall health security agenda, and I'm not speaking just because many of the people who died of COVID actually died of antimicrobial resistant infections that were a complication of their hospital care, but just broadly in the domain of threat agents and the importance of having antibiotics to treat people with some of these serious complications. One could make the argument that it's a responsibility of government to make sure that we have these drugs in our stockpiles, or that we invest in them from a national security perspective. I'll ask Ingrid from the European perspective. Do people get it? Do they see this as part of a broader security agenda?
Thank you, Julie. Yes, I think they do. That's certainly the case. And we, at our side, I think we have also various strategies on how to make sure that AMR stays high on the agenda of the governments, but it also is communicated to the health professionals or even the population here in Europe. One of those instruments, it's a very large project. We are running with all European countries and will start probably early next year, so we are in the preparation phase. We have taken some 50 million euros for all the EU countries to work together in the field of AMR. And one part is also to look at stewardship and to look at the prescription and the communication with the public. Not to say that obviously we also look at surveillance and other issues in this large project. Looking more at the market, we also have just in April come forward with a new legislation in the field of pharmaceuticals here in Europe. And there we are pioneering a temporary mechanism which is completely innovative. And it is a transferable data protection voucher for developing new game-changing antimicrobials. So that is a policy proposal. It's not there yet, but it is a completely innovative proposal which we have never done. So it is important to stress that these vouchers would be granted and used obviously under very strict conditions. For instance, they would only cover novel antimicrobials with significant clinical benefit, or supply obligations and fulfill transparency regarding the direct public funding received. But we think through that, we are hoping to also, keep up or bridge the gap of this market failure, which is, as somebody said, our failure. And we are trying to step in and ensure that we would have the drugs that we need available for the population. Thank you.
Thank you. There is innovation, and when you think of BARDA's investment, the European investment, CARB-X, the AMR fund, which is $1 billion fund that industry fronted, all of these mechanisms are trying to push the innovation into the pipeline and through the pipeline and hopefully come out the other end. But as you pointed out earlier, unfortunately, when we've had success with that, we've seen biotech companies go out of business because there was really no commercial pull through at the end of the day. So a lot of the experiments that are going on, Pasteur Act, the different models in Europe are an attempt to fix that. But if you just use some common sense, what we're really saying is please don't use these drugs unless you absolutely have to, which means we can't count on a volume of utilization. That would defeat the whole purpose of what we're trying to accomplish here. They're not quite orphan drugs, but they're somewhere in this weird zone where we need to have them available and use them when we need them, but not overutilize them and to be as precise as we can. And that really doesn't work in the payment schemes because by definition they would have to be more expensive than what we're used to in the anti-infective. So we're kind of in a situation where the government has to be helpful. It's hard to think that there's another solution. Do you see the government not just stepping in from the standpoint of the biosecurity agenda, but beyond that, with government contracting, for example, for anti-infectives?
Yeah, so I think that's for me personally. I would say I'm glad again for this program today. I would say that's a conversation between both the executive and the legislative branch to kind of come up with solutions, at least from the U.S. perspective, and I'm sure it's the same in terms of trying to work with the budget holders in the other. Participating folks, but I mean, I agree with that, and I think it's something that we're very much wrestling with in terms of how to do this, because it just is the case that we have enough evidence now that we can't just simply hope that that this works out. We have to value these. Medications for what they are and what they contribute, and then act accordingly. And I think there is a notion we've talked about it. Several of us have, and Steve in your intro as well. I mean, just recognizing that these issues. I mean, fundamentally, right? It's not hyperbole to say that modern medicine is at stake here, and so the things that are the reserve drugs now are likely to be the frontline medicines in the future, and so we have to have a national security mindset about this, and also recognize because of the nature of resistance that there's not. We can't. None of us can be islands unto ourselves either. We have to work collaboratively, transnationally, to find the solutions that will really, protect our collective health security in this space.
So Ingrid, let me come back to you and just kind of following on that, this transnational perspective. Clearly, we have the transatlantic. The TACFAR mechanism, but the problem is a global problem. How does TACFAR really connect with other parts of the world that are also struggling with access and availability of treatments for serious infections, but also in some cases, dealing with the crisis of drug-resistant infections in their healthcare systems now with even fewer resources available than we have here in the transatlantic environment? How do we connect and support and learn and share with our broader global colleagues?
Yes, this is really an issue we acutely realized also during the COVID pandemic. And this is why we decided to revise our health security legal framework here. And as part of that, I already mentioned it, the HERA was created. And there they will be working very strongly on different pull incentives and also globally in terms of making the needed antimicrobials available. And I'm sure my colleague Wolfgang Philipp will go into that work in the next session. Looking at the hospital-acquired infections, that is also an issue we are addressing now here in the EU with our new legislative instruments that we have together also with the different agencies. And we are always very happy to share. I can report that we do have a very good exchange and collaboration, for example, between our European Center for Disease Control together with the African Center for Disease Controls on various issues, including AMR. So we are outreaching through our global partners. Last but not least, we also have a new global health strategy that was discussed and that was also agreed last year, where AMR in the frame of also health security and universal health care plays an important role, in which we are also then implementing through what we call Team Europe, which would be the EU together with the different member states, where we also put pooled resources on the table to support our global partners. Thank you.
Thank you. It's good to hear about that connectivity. We're at a point now where I think I can encourage the folks who are in the room, if you have questions or comments. We have a microphone in the back of the room. If you would march up there and give us your name and ask your question or your comment, we'd love to hear from you. While we're waiting for that, I would just kind of like to go back to the point you were making about the COVID pandemic and what we might have learned in that context. I think everyone wants to put that in the rearview mirror, and it's getting a little bit painful to keep going through these after action reviews and these look backs on COVID. As we all know, it's actually not over yet, but hopefully we have learned some things along the way. But when we think about the pandemic in the context of that global health threat and what we might be able to translate from the COVID experience into the AMR pandemic that we are experiencing, what are some of the most important lessons that we've learned? Linda, I'll start with you, but I'll ask all of our panelists to respond to that.
Yeah, that's really important and key. And I have to say, it's been really commendable for the global community to keep AMR not just on the agenda, but kind of somewhat to the top of the agenda when we discuss health issues during COVID. So I'm thinking of the G7 presidencies and G20 presidencies of the past couple of years, right? I think it really speaks to our collective will and the sense of urgency that we have to keep focusing on AMR. And in fact, Canada's own AMR task force, a new program was built on the tail end of the pandemic. I think what COVID has done is brought more attention on health threats that can become big problems. And I think COVID for us has became a key opportunity to really raise public awareness on AMR. I think there's appetite for the general public to be informed on health threats and better understand them, and to demand from their governments that we be better prepared. And so I think health literacy as a result of COVID has been a very positive development. And I think preparedness now is top of mind. And speaking of AMR as part of that preparedness framework, is now accepted in the global community. And I think it's very important to keep AMR as part of the pandemic instrument and the other preparedness and MCM conversations. in order for us to keep thinking about this issue that will require long-term solutions.
Thank you. It's really a teachable moment, right? I mean, we're in a state where people are aware of threats and hopefully aren't so eager to put it behind them that they can't look ahead to what we need to do to make sure we minimize the potential for this to happen again. Do you agree with that?
I do. I very much do agree with everything that was that my colleague just said. The only thing I would add in terms of maybe a lesson learned that we're trying to still kind of frankly explore and get and flesh out in more specific policy detail is the issue of One Health. And I know we're not tackling that directly here, but in this session this morning, but recognizing those linkages and the gaps that are there in terms of, for example, veterinary animal health surveillance systems communicating effectively with human health systems and getting at some of those. Just getting at the need to create some of those linkages more effectively over time. We've engaged, for example, our Center for Veterinary Medicine at FDA in some of the recent TACFAR meetings expressly for this purpose, and I know colleagues are doing the same with other TACFAR members. So I think that's the only thing I would add, really, is to the great list that was provided on preparedness and prevention would be the One Health, and going beyond the rhetoric of One Health to the specifics of what does that actually look like from the nuts and bolts of getting different agencies and sectors to cooperate more effectively.
Getting serious about the gap between the principles and the practice of One Health.
Yeah.
Ingrid, Europe is a bit ahead of the rest of the world in the One Health dimension. Specifically, many countries in Europe have taken this seriously long before the pandemic, but COVID is an exemplar of One Health issues. The animal spillover, the spillback, the ecosystem, the environment, the sewage. It really brings it all together, and it is a teachable moment from that broader perspective. Do you see momentum in the One Health movement coming out of this?
Thank you, Julie. Yes, we certainly see momentum, if I can directly take up your question. And I mean, to give you a very blunt example, we here at the Directorate General for Health and Food Safety have been reorganized last year. So I'm in the European Commission. In our Directorate General, we actually now have a whole directorate, which is called One Health, which we didn't have before. So I guess in our organigram, the very first thing you see if you start reading from left to right is a full directorate on One Health. So that tells you that we have learned an important lesson also from the COVID, that One Health is key, and that is now also reflected in our work, how we work together more closely between the animal health and the human side. And we also reach out to the colleagues on the environmental side, obviously. Maybe also one more point I would say in terms of lessons learned from COVID, we know that our trust with the population is a very precious good, and we should treasure that. We have seen that in the COVID vaccination campaigns, but I think for AMR it is as precious and as important to keep that. So one of the important highlights of the year we are taking up here in Europe, also with our European Center for Disease Prevention and Control, is the Antibiotic Awareness Week, which is in November every year, where we are putting out lots of material in different languages. We also collaborate with WHO and NGOs to really get the message out to the public and taking the momentum of this week every year to spread, modifying the message maybe a bit every year, reaching also out and engaging health professionals to really engage with the public, because after all, it's them who need to understand the issues as well. And like for the COVID vaccination, we are really depending on their behavior. Back to you.
Thank you. And before we close the session and we thank all of our panelists, I just really want to say that sitting here, I feel a little bit more optimistic than I did when we started our discussion, because there is a lot happening and people really are recognizing the opportunity that we have to move this agenda forward. I'd just like to close with a flash question. If you could just ask for one thing from your decision makers, just one thing that you think would really be important in addressing the AMR issue, what is the one thing you would most wish for? Is there a volunteer to go first on that one? I'll ask Linda, because our Canadians to the north are usually very on top of their game. And
Thanks, Julie. I would say permanent sustainable funding. It's very difficult to go beyond piecemeal fragmented efforts when you don't have funding to build a sustainable long-term program of investments.
Thank you. Colin?
Yeah, a sustainable commitment beyond, right, we rely a lot on personalities and individual commitment of individual leaders, and a sustained commitment over time, including resources. I agree.
Ingrid?
Yes, I mean, we are coming from an EU angle, but we are also looking at the global angle. So for us, it would be really important to see a very strong AMR component in the pandemic agreement, which is currently under negotiations. So that's something we have been put forward language, and which is something we are working on. So we really would like, to keep this there. And then it is in the agreement, which will then hopefully be ratified by many, many countries globally. So I think that would be a very strong asset to have. Thank you.
Thank you. You can see that our panelists truly are experts and really bring a lot of experience, but a lot of creative thinking to play here. So thank you all for participating. Thanks to TACFAR, the CDC Secretariat, and everyone who's been involved in moving this agenda forward since 2009. The time is right. Let's strike while the iron is hot. Thank you.
Thank you so much.
And I will introduce Krishna. Ooh, where did he go?
He's in the back. I think he needs our...
Okay, Udaya Kumar, Dr. Krishna is going to take us into the next panel and lead the next discussion. But let's have a round of applause for our panelists. Thank you. Thank you.
Well, thank you so much for that warm introduction. Pleasure to be here and And thanks also for such strong moderation of the last panel. I'll invite my panelists up here as well. Over the next hour or so, we're going to continue the conversation and focus from what we just spent some time digging into, this transatlantic partnership, the policy perspectives, and of course, we're going to now also think about how we accelerate research and development that's so important to the field of antimicrobial resistance, and how we think about the ways in which we can make this whole field more sustainable as well. So it's a pleasure to be joined here by Dr. Chris Houchins, who's the director of the Division of Chemical, Biological, Radiological, and Nuclear Countermeasures at BARDA, the Biomedical Advanced Research and Development Authority in the U.S. government, and ambassador in Dr. Malin Grape, who's the Swedish ambassador for antimicrobial resistance. And virtually, we are also joined by Dr. Wolfgang Philipp, who's the head of unit for the European Health Emergency Preparedness and Response Authority, or HERA. So we have some eminent folks here to talk with us, and to ground the conversation, let's just get a sense of where we are in terms of the state of the science. We've talked about the challenges with the pipeline. We've talked about some recent advances that have been made. So Chris, let me come to you first to help walk us through where we really are with the state of the science for antimicrobial resistance, and what to you have been the most important developments over the last several years.
No, thank you very much, and again, really welcome the opportunity to be here today to talk about some of the things that we've been doing at BARDA, but also especially about our partnerships that have really been focusing on advancing the science within the AMR space. I would say some of the greatest achievements or some of the greatest efforts and initiatives over the past several years within BARDA, but also amongst our partners, is really investing in novel technologies, novel antimicrobials to address the issue of drug resistance. So really, we've invested for many, many years in the development of small molecule antibacterials, but we've really recognized that we have to invest in new modalities to address the emergence of antibiotic resistance by targeting new types of epitopes, new types of mechanisms of actions, and really developing, again, new types of innovative antimicrobial products. We've worked very closely with our international partners over the past several years through the CARB-X Accelerator that is led by Boston University, but includes partners at Wellcome Trust, at the Gates Foundation, at NIH, the German, the UK governments, and most recently the government of Canada. And really that is focused on innovation. That is looking at new modalities, new approaches to address the rise of AMR, not just doing the same thing over and over again, but really looking at new types of technologies. Through that partnership, through that platform, we've invested in new types of modalities like microbiome-based approaches, phage-based approaches, looking at CRISPR-based approaches as well. But really looking at those types of interventions and technologies and innovations that really can overcome AMR, rather than just continuing to invest in small molecules. Obviously, small molecule antibacterials are always going to have a significant place in the larger global armamentarium of antimicrobials, but we really need to tackle this differently. Bacteria keep figuring out new ways to solve the solutions that we throw at them, so we need to keep figuring out new ways to counter their counteroffensive as well. So, so working through CARB-X, we really have made significant investments in those novel types of technologies. We have partnerships, obviously, through our public-private partnerships with small biotechs and large global pharmaceutical companies through our advanced research and development portfolio, where we are also looking at the advanced development of these novel, innovative technologies. We're looking at also working with our other international partners, where we have a shared interest, a shared strategic interest. I'm joined, obviously, by my colleague, Wolfgang, who we've had many, many conversations about tackling the issue of AMR and how we can work closely together and identifying those appropriate strategic partnerships and I would say, where we are well aligned in terms of making co-investments in product development. So, it really is focused on the science, again, developing new innovative modalities that counter, the ability of bacteria to continue to evolve resistance amongst to novel antibacterials. Really kind of advancing these products that are in earlier stage development through our advanced development portfolio, but really we can't do this without our both federal and global partners.
Great, thank you so much. It's a good grounding for us. Wolfgang, let me come to you next from the perspective of here. How are you seeing the current pipeline? What are you most excited about in terms of recent developments? And to build on this idea of partnerships, how has this transatlantic partnership really been valuable in advancing the science?
Thanks for the invitation, first of all, and happy to see you all there. About the pipeline, Chris mentioned a lot of investments that are going on into basic research and development, but also let's say late-stage research and development, which is great. On the other hand, if we look at antibiotics and the innovation in the field of antibiotics, I think that is not my personal opinion, but I think it's widely shared. The evolution of the antibiotic innovation is to a certain extent worrying. There has been a lack of innovation in the field of talking about antibiotics, and that simply means we need to invest more to re-incentivize research into new classes of compounds. In particular, I think that is one point. Chris mentioned already a large number of areas where investments are going on and where innovation is really at high speed. Alternatives to antimicrobials, non-traditional agents, promising technologies, phages, micromodulators, immunomodulators, antibodies, and so on and so forth. Vaccines is also an area that's coming up more and more as an alternative to the use of antibiotics or for treatments. But on the other hand, we have seen that great progress has been carried out also in the field of AMR diagnostics, which is supported obviously by the development of new technologies or rapid point of care diagnostics. That is an area where we certainly need to do a bit more, but on the other hand, it all comes together in the picture that we further need more innovation in the whole field. So not just on antibiotics, also in the other fields, although modern technology allows us to make progress in some of these areas. We need to do these things together. On the European, I can only talk for the Commission. Here, that was mentioned already before, we have 27 member states. We have research programs that are usually investing into push incentives, so basic research and development. Under the last research program, there was more than 700 million euros, so about $800 million invested into AMR research and development. There were also public-private partnerships with industry carried out. There was a joint programming initiative on AMR, and now in the future we are setting up and investing another up to 100 million euros into a One Health AMR partnership. So there's a lot of things going on that all goes into the area of research and development. And then we have a second possibility that is through what we call the health program. Here we can invest more into the incentivization of late-stage development of products. We are thinking about collaborations and have discussions with BARDA about these things, and also other international partners. So a lot of these things are going on. International collaboration is important to avoid duplication, to avoid redundancy, and to have a clear understanding which are the next areas that need a fresh push. And that can be done through R&D, R&I, push incentives, and perhaps you can also talk a little bit later, a little bit more about pull incentives, where we see huge potential for, let's say, for triggering the AMR pipeline.
Thank you. Great to hear about these new initiatives and the significant investments that are being made as well. Malin, coming to you, we've heard a lot about specific innovations, whether that's in the therapeutics, diagnostics, surveillance. In your role as an ambassador, you're bridging the science and the policy and the politics. How do you think about all of these pieces fitting together into cohesive policy and generating political will behind those policies?
Thank you. I think that's a really important question, of course. Sometimes I get a little bit scared when we talk about all this progress and all these great initiatives that we have, that it might sound too good. Like, what is the problem here? We have so many promising molecules and projects going on, for example. But I would like to go back a little bit to where Julie started the first panel. Why do we not see enough engagement in this? Why do we not see enough investment? And I believe that we have to shift the perspective a little bit. We can't get engagement despite, I mean, yes, we have these figures now. We have the 5 million associated deaths. We have the 1.27 deaths directly caused by resistance, which is more than AIDS and malaria. But still, it's too vague. And I mean, I can't blame people for not being scared of an abbreviation. We talk about AMR. What is that? So I think this is a really important issue to start with. I mean, the ultimate goal cannot be to fight AMR, right? The ultimate goal must be to make sure that we have a sustainable access to effective treatment. And this includes not only treatment of common infections, but antibiotics are also the basis for, I mean, both the basic health services, but also the modern medicine that we know today. So I think this is, I would like to kind of shift the language a little bit and talk less about AMR and talk much more about access to effective antibiotics. And now, I mean, AMR is including all microorganisms, while antibiotics, of course, that's the bacterial infections, but they do have a certain, I think they have a certain place here where we have to focus much more on antibiotics specifically. Not saying that fungal infections and viral and parasitic infections are not also threatened by resistance development, but antibiotics are really important.
Yeah. Oh, thanks. Very important perspective that, as excited as we in this room might get about AMR, I suspect that doesn't quite hold the same interest at a community or public level. So really the way we frame this is going to be extremely important. And in that framing, I want to build from part of the conversation of the prior panel. We're in this post-emergency phase of the COVID-19 pandemic. We're starting to see a lot of conversations moving in one of two directions. One around the broader pandemic prevention, preparedness, and response, PPR, and what needs to happen there with what we've heard about the negotiations of the INB, the IHRs and the like. The other place we're really trying to move this conversation is really talking about resilient health systems and the role of primary care and how to build those in. Clearly, both of those are very important to address some of these challenges that we have identified here around AMR. How do you see this? We heard a bit from the first panel about ways this might be part of the conversation, but it's not readily apparent. It's not clear that AMR surveillance is part of pandemic PPR surveillance, as one small example. How do we be sure that the current policy conversations and financing conversations are aligned between what traditionally may start to break down into verticals again? So maybe I'll start with you and ask anybody else to chime in. Malin.
Thank you. No, I think this is really important. Somehow it surprises me a little bit that when looking at preparing for new pandemics, of course we need to learn from the past, but it's still a little bit narrow, isn't it? When we talk about medical countermeasures, for example, the focus seems to be so much on vaccines. While again, antibiotics are such an important countermeasures, and that goes for both a new viral pandemic, where most often you have a lot of secondary bacterial infection. You will need to have access to effective antibiotics, but also what we call sometimes the silent, I don't like this very much, but maybe the ongoing pandemic of AMR, or as my colleague James Sally Davis used to say, the grand pandemic of AMR. So, so to me, it's so clear that yes, AMR is an obvious connection with PPPR, and preparedness would include, as you say, surveillance, the One Health perspective. It needs to be there. It needs to be very well reflected. But also when it comes to access to countermeasures, that it needs to be more highlighted, I believe, in this conversation.
Yeah. Chris? What?
No, I think it's a wonderful question. So BARDA was established, as many know, back in 2004, 2005, to really focus on developing countermeasures to address CBRN threats, emerging infectious diseases, and pandemic influenza. And really underlying all of that are the secondary bacterial infections that are driven by drug-resistant bacteria. And so, as part of our ability to be able to effectively respond to any sort of pandemic in the future, we need to ensure that we have effective, novel, innovative antibiotics that are able to address, those secondary bacterial infections. As a result of COVID too, we've also saw, as Julie pointed out, that many people were able to overcome or survive infection by SARS-CoV-2, but then succumb to those secondary bacterial infections. So we need to make sure that, effective drugs, effective antibiotics, are part of that ability, part of our response capability, part of our response armamentarium to any sort of public health emergency, including pandemics. One of the lessons learned out of COVID-19 is that, we have to have not just products that are available to respond immediately to an event. We also need to ensure that we have capabilities that allow us to quickly evolve the development of new products, new medical countermeasures, to stay on top of or stay abreast of or to continue to evolve with emerging threat. So it could be a novel emerging threat, or it could be like SARS-CoV-2 was back in January of 2020, or it could be the emergence of resistance against currently available therapeutics. So we've made significant investments over the past several years, actually over the past decade or so, on platform capabilities that allow us to rapidly respond by developing new vaccines and therapeutics to an emerging threat, and also to the emergence of resistance against currently available antibiotics, currently available medical countermeasures. But I know we're going to be taking those lessons learned and a lot of those platform capabilities as well, and applying it to the AMR space going forward. Because the traditional timeline to develop a new antibiotic from discovery to licensure, can be a decade or more. So that doesn't really bode well when you're trying to stay on top of, the emergence of resistance in a bug that has a lifespan of 20 minutes, and is able to, generate resistance within a few years after a new drug is introduced to the market. So we need new ways, new platform capabilities that allow us to rapidly respond and develop new therapeutics, new antibiotics, new antimicrobials that we are evolving, those new products along with the evolution of resistance in the bacteria. Yeah. So I think those are, two areas that, we're really focused on, is ensuring that we have, effective products immediately on the shelf to be able to respond to the secondary bacterial infections that occur following any sort of public health emergency or pandemic, but also ensuring that we have capabilities that allow us to quickly discover new types of antibiotics or antimicrobials to an emerging event. And, kind of going back to what I was mentioning earlier, some of those new capabilities are things like, CRISPR-Cas technologies, siRNA, microbiome approaches could be another way as well, but really looking at innovative approaches rather than just small molecules. The other thing that we're doing also at BARDA is really making significant investments in new types of, in vitro approaches, like microphysiological systems approaches, that really help us to compress the timeline from discovery to development of a new effective product. So really kind of taking an all-hands approach ensuring that we have these capabilities, these countermeasures available to be able to respond immediately, and if we don't, being able to compress the timelines in which we go from a new bug to an effective, safe therapeutic as quickly as possible.
Yeah, no, thanks. Great perspective and thinking about platforms that are ready and then how quickly you can mobilize them towards specific threats. Wolfgang, let me bring you into this conversation as well. Obviously, Hera, you're looking at health emergencies broadly defined, and where do you see this this intersection between AMR and pandemics and PPR more broadly there?
I think at the end of the day, what this pandemic has taught us is that we are able to react quickly, and that we are also able, if we collaborate at a relevant international level, that we are able to develop countermeasures and also ways on how to react, how to prepare first of all, and then to react to potential pandemics. When it comes to AMR, I want to come back to what Martin said. Obviously, I mean, innovation and access, this is just one part of controlling potentially AMR. You mentioned awareness, you mentioned surveillance as a very important point, stewardship, IPC measures, and a couple of other policy fields. And that is obviously something we should not forget. It is a very broad approach that requires a lot of, let's say, resistance to keep on going. So it is not just that huge investments into the R&D or R&I side would potentially bring the major breakthrough, but it is absolutely required. We at Hera, we are responsible for the development, a bit like the BARDA, for the development and availability of medical countermeasures to potential threats. And for us, AMR is one of the three top priorities along which we focus in the first 2 years of existence, our investments when it comes to research and innovation, and also when it comes to development. So it's very important that we continue on our side, ideally in a, let's say, aligned approach with other funders and with other agencies or entities that support research and development or R&I into AMR, that we do this in an aligned way. First of all, to gain speed. Secondly, to gain time, and thirdly, hopefully to be, let's say, more productive than and more successful than we have been in the past 10 years.
Mm-hmm. Thank you. Also very helpful to understand that broader perspective. Let me perhaps now broaden the aperture a bit. We've been talking mostly about this transatlantic alliance while recognizing that antimicrobial resistance is a global problem, and in fact, the greatest burden that we're seeing in deaths, morbidity, are in low and middle income countries. Recognizing that the principles may look very similar, but the health system context, the populations that are affected might look quite different based on geography. How do you see, Chris, let me start with you, the understanding more globally of the burden influencing priorities in terms of how you're making decisions on R&D, on the science, what problems you're taking on in this broad field, and also how you're designing new products and technologies to be fit for purpose where it might be most needed?
No, it's a wonderful question. And, I would say that obviously through BARDA, we have, a perspective on developing and delivering, effective medical countermeasures to address the U.S. population. But we understand that AMR is not a U.S. problem, it's a global problem. And so we need to be able to ensure that we are developing products that are available across the globe and effective across many populations across the globe. Because, being able to address, AMR in other parts of the world are going to ensure our national health security preparedness here in the United States as well. So we do take that, keep that in mind in terms of, developing products that are going to be effective across a range of populations. One of the things that we do with a lot of the partners that we develop antibiotics with is we support, large global phase 3 registrational clinical studies so that these products are being evaluated in populations across the world, so that we want to ensure that we have products that are, that are going to be able to meet our accessibility requirements as we get these products approved. And that's important for us for a number of reasons. One, again, because AMR is a global problem. We're not just concerned about the U.S. population. We want to make sure that these, products are effective, to all different patient populations, but also, products that have, I would say just a U.S.-centric focused or U.S.-centric market really doesn't do, I would say, hampers us because, as we understand, the sales volume of antibiotics are so small. And even here in the United States, in which it is one of the, it's a large consumer, it is still a very small market for any drug development company or any company that's developing antibiotics. So we want to ensure that we are assisting companies to help to develop these products that are going and get them into global markets so that we are able to ensure that there is global access and global market for these products, that these companies are going to be able to sell to a larger market, generate the revenue that makes them allows them to be sustainable. One of the things that we've learned over the past several years, and I would say that we've been a bit chastened by this, is when we established our antimicrobials portfolio back in 2010. We had, naively assumed that once we developed, new antibiotics, that there was going to be an instant market for them, and that these products would be out in hospital formularies and pharmacies and in the hands of physicians, so that the products would be available if we ever needed them to address secondary bacterial infections or even biothreat infections. We learned after investment in numerous companies and hundreds of millions of dollars that after these companies got products approved, that the companies failed because there was no market for them. So we are really looking at working with our international partners like like HERA, like Wellcome Trust, like GARD-P, like the Action Fund, SCARTA, which is the Japanese health agency as well as with the European Commission, looking at how we can partner together to ensure that we are developing markets, looking at innovative approaches to develop markets or solutions that will allow us to have a global market for the accessibility of these newly approved antibiotics. So that, again, we're not just focused on the U.S. market, we're focused on a global market that allows these products, these companies to be sustainable, long after they get products approved by regulatory agencies.
Yeah, that's great. And something we learn over and over again, it seems, is that you actually have to design products from the beginning for where they might most be needed and where they're used, and trying to translate from one context to another is often sometimes more difficult than the science of developing the product themselves. Malin, let me ask you, how do you see this transatlantic partnership really serving a global leadership role? How do you partner with more low and middle income countries to think about global solutions?
I think that's extremely important, of course, and Sweden being part of the European Union, that in itself, of course, is a very important collaboration that we have. As you heard, we are currently the president of the Council of the European Union. This is coming to an end very soon, next week. But this was not the first time that we highlighted AMR on the agenda during our presidency. So I think this is, and the transatlantic collaboration and the global collaboration of AMR was also something that we highlighted during our presidency. So what we did, we're fortunate enough to having started really early. Just as a very brief background, Sweden banned the use of antibiotics for growth promotion in animals in 1986. 20 years later, we convinced also the members of the European Union to do the same. Our national stewardship program, which is named Strama and has been quite famous for its success, that started in '94. Since then, we had an uninterrupted decrease of antibiotic consumption in humans. So of course, we're lucky enough. We started early, and we do have a lot of experiences in this. But what we wanted to highlight now during this presidency, antibiotics also affects and is affected by what's happening in the world around us. But I would also like a little bit to come back to the interconnectedness between the development and the access. because, and we also wanted to illustrate this, but because, you know, this is not a linear process. It's not like we start with research and development and we make sure that these candidates come all the way through the pipeline, and in the end we have them on the market, hopefully also accessible to everyone. But as long as we use antibiotics, we will also have development of new resistance. So we wanted to illustrate this in a circular way, that this is, you know, we will never be ready, we will never have the drugs that we need. And this goes very much together with the access to existing antibiotics, because, I mean, to save the ones that eventually will become developed and put on the market, we will have to have access to all the existing and still effective ones. And Sweden, US, the EU are not the only ones suffering from you know, stockouts. The weak production and supply chains affects us all. But we also suffer, and especially I think small markets like Sweden, with successful stewardship, we are not interesting markets. We also suffer from market withdrawals of still effective antibiotics that we would need to keep in the toolbox. So, and this of course goes together with the use and the surveillance. So this circle and the weaknesses and the possible solutions of this entire circular chain, this was something that we make an expert meeting also during the presidency, where we really digged into many of these weaknesses and the possible solutions. So, I mean, this is a lot of experiences that we have now. We have a lot of options already on the table. We don't need to invent so many new things, but I'm convinced, and this was also one of the conclusions from this meeting, that we need a comprehensive package of different solutions. One pull incentive will never be enough. It's not going to be strong enough, but we have to really look at the weaknesses and see what to do along this chain. So an end-to-end approach is what we're looking for here.
Yeah, thank you. I think really important to understand this idea of sustainable access, right? And love the idea of this. It's not a linear approach. It's much more circular than that. Wolfgang, let me ask you, in this idea of sort of global perspectives, how have you thought about a portfolio approach and what you're prioritizing, what you're trying to look at investments in to try to understand how you can support global equitable access more effectively?
Yeah, portfolio approach is certainly a possibility. Guaranteeing or contributing to support global access more effectively, that requires certainly leadership role of certain countries. It requires also, we have heard about TACFAR earlier, that is not enough. It goes beyond. It's also about Asian countries where a lot of activities are going on, Southeast Asia, Japan, and so on and so forth. So there is a lot that can be done, but the implementation needs a good level of coordination. That's one thing, coordination. And second point is obviously financing, because at the end of the day, when it comes to access, we're talking about, when it comes to access, we're talking about funding, and we're talking about also pull incentives to get, let's say, better or new products through the pipeline and to make them available to all countries across the globe, including low and middle income countries. So what HERA is doing, I mean, Chris mentioned already a couple of points that would apply to us, of the European Commission. What we're doing more specifically is we're supporting, for example, GARP that was mentioned, but also another initiative which is called Secure, and both initiatives are contributing to improve access to antibiotics in low and middle income countries. And when we then go down and analyzing a little bit better what these initiatives are doing, these and other initiatives are doing, it's very interesting to see how the details are sorted out. That, like for example, licensing, like for example, a tech transfer agreement, which is signed between GARP and certain antibiotic producers. So what we need to have at the end of the day is funding, We need coordination, and we need political leadership that trickles down to operational leadership.
Thanks. Very important points there, including this idea of pull incentives being really important. And let's maybe dig into that a bit more. We've talked a lot about how do you create the science, how do you push the science through the R&D pathways. And of course, when we talk about pull incentives, a lot of times in other aspects of health, we're talking about demand generation. And we've talked already about many of these products, especially antibiotics, being different in that we're not trying to increase volume. We're trying to make sure that there's access and stewardship at the same time. How have you seen, are there effective models to try to make sure that there are pull incentives, that there is creation of a functional market, or at least addressing market failures in ways that are able to balance access and stewardship? Malin, would you like to get us started?
Yeah, I can start. No, as I said, I think it's really important to have a package and a comprehensive approach, but you also have to try something out, right? I mean, we've been talking about all those different models. We do know that we somehow would benefit from delinking volumes of sales from revenue. Obviously, from what you say, that we need to use as we need to use not as little as possible, but as appropriate as possible, I would say. So what we have done in Sweden is to pilot a partially delinked model, which is a revenue guarantee model for reimbursement of access to antibiotics. Now, so this is it's not designed as a pull incentive. It's designed as an incentive for access, and again, because we have to do something to get hold of these new important antibiotics in Sweden. We will not have them on the market unless we do something differently. So we tried this model. We just concluded this pilot. It was reported 2 weeks ago. There is a report published, unfortunately in Swedish, but there is a summary in English, so you may find interesting reading that. I mean, these experiences, even though this was for access, I think they could be really valuable when we go together and look at how to expand and how to move on. Mm-hmm. So we are also looking forward to work closely together with the EU Commission, and especially here, of course, on this revenue guarantee model, and together with other countries. We are also fortunate enough to being connected now with the Canadian initiative and the pilot there. So we very much look forward also to follow this and to learn more from their experiences.
That's great. Chris, you've talked a bit about public-private partnership. It's a good bit of what you do. We all know there's never going to be enough money to do everything we hope, and we can really only substantially address this problem if there's private capital, and there has to be some sustainability related to that. What are the ways that you've been able to source in private capital to help support this field?
Well, the funding, for the most part, the funding that BARDA provides to product developers is non-dilutive funding. I mean, we do have another arm of BARDA called Ventures, which provides equity-based investments in the companies developing countermeasures or technologies that address BARDA's mission space. But it's kind of focusing on the AMR field. All the funding that we provided over the past 15 or 16 years has been non-dilutive funding. And what that does, whether it's through our advanced development portfolio, whether it's through our, I would say, our post-licensure portfolio, in which we use a different pot of money called Project BioShield money, or even if it's in our earlier preclinical development portfolio, which is really largely supported by CARB-X or managed by CARB-X. Every dollar that we invest into a company to develop a new product often results in private equity coming off the sidelines and investing in those companies as well. I'm not sure exactly what the metric is right now, but a few years ago when we ran the analysis of the CARB-X portfolio, we saw that for every dollar that BARDA invested into CARB-X, there was about $8 that was pulled in, from the private sector to support the development of those antibiotics. We haven't seen a 8-to-1 match necessarily in our advanced development portfolio, but we do see that often when we are working with a small biotech company and make an investment into that company, that does open up additional capital or access to capital for those small companies. Also, for large pharmaceutical companies, they're often not looking for private investment, but when we invest in the development of a candidate with that's being developed by a large pharmaceutical company, that company will then often provide additional resources because they see that they are getting non-dilutive funding as part of this partnership, this private-public partnership. And so, it really has, I would say that the public financing, the public funding of AMR research and development has really, served as I would say a mechanism to allow other private investors and other private equity to start coming into the development of AMR. So, we see that as a positive. Obviously, we haven't addressed the failed market. Not enough capital is coming in off the sidelines. Private capital is coming in off the sidelines to really sustain, this area. But with the companies that we work with, it has been hugely beneficial.
That's very good to hear. And Wolfgang, how have you thought about the financing innovation that has to match the innovation in the science to make this more sustainable over time?
We are a young organization. I would just like to remind us of this. We are thinking about possibilities apart from push incentives, so apart from investments into research and development, but to look more on the pull incentive side. So that's one possibility. First thing we have done is to run a study, basically to explore various options for implementing pull incentives for antimicrobials through different procurement mechanisms such as revenue guarantees, market entry rewards, milestone-based rewards, or a combination of revenue guarantee and market entry reward. So there is a lot of different possibilities here. I think it was mentioned already. Reports, data, and proposals are largely available. But what we found is that based on a literature review, pulling effect of each mechanism, depending on the size of the reward, would be ranging from 700 million euros to 3 billion per antimicrobial developed. So these are big figures, and that is certainly something that, let's say, one entity could hardly support. So what we are doing now is with EU member states to see in how far we could establish a network to support HERA for the implementation for one or for some of these chosen schemes. We are also thinking about, and that is part of the recently revised pharmaceutical regulations in the EU, about transferable exclusivity extension vouchers. Sorry for that. Long name. Basically what it says, it's to provide a higher reward to developers of novel antimicrobials that could be used to incentivize access and to protect other products than the antibiotic when buying such a voucher. So that's another idea. So there's many elements out there. We heard something from Sweden. We know about many of these things, but at the end of the day, it comes with investments, and we have to see what is the let's say the most effective way in pulling some of the good products which are currently also in the pipeline and with a higher technological readiness, to see what is the most appropriate way of doing it. There will be not the usual one size fits all, but probably adapted models that we need to use. Something else that HERA is also setting up now is a way of providing loans to companies that work also in that area through what we call HERA Invest. That is going to be a top-up to an existing program run by the European Investment Bank. And we hope also to attract additional external funding to that scheme and not just incentivize development of further vaccines or other medical countermeasures, but also of novel antimicrobials.
Fantastic. Great to hear about the breadth of options being pursued or experimented with there. Thank you. I'm going to come to the floor in just a minute, so if anybody has questions, please do let us know, and there's a microphone in the back. But first, Malin, I want to come to you. We've heard a couple of times now about some recent progress in the EU with leadership from Sweden, including this transferable data exclusivity voucher as part of Council recommendations more broadly. Tell us a bit more about how that came together and what that package actually looks like.
Yeah, thank you. And just to be very clear, the transferable voucher is not concluded yet. So that's part of the pharmaceutical legislation, which will be negotiated probably for quite some time, because it's a huge package of a revision of this legislation. But what came with this pharma package was also, as Ingrid mentioned, this legal instrument which is called a council recommendation. And this is what we were really happy to be able to conclude during our presidency. So even though we had a really short time, thanks to the constructiveness and the cooperation with all the 27 member states, we managed to conclude these negotiations. So this was agreed by the health ministers in the council last week. So we're really happy for this. And this legal instrument, it reflects, as Ingrid touched upon, the broad spectrum of AMR work, including surveillance, stewardship, infection prevention and control, but also some of these elements on access and pull incentives that HERA will take lead on. So we're really happy that what was discussed during this high-level meeting in Stockholm is also very much reflected in this council recommendation, including the work on international collaboration on the global level. But what I'm really happy about also in this, and which I think is really promising also for the high-level meeting in the UN General Assembly next year, is that the 27 member states actually came to an agreement on specific and measurable targets on antibiotic consumption and on resistance. So I think this is really promising. And to me, this is also what we will need, some kind of measurable targets, concrete and tangible targets to work for in the political declaration of the high-level meeting of 24. So I think this was promising. Of course, I do understand that the 27 EU member states is just one small part of the entire world. But also when we talk about targets, we should think very carefully about how to design these. And I mean, the focus of this panel has been access to new antibiotics and development. So why not put a target, for example, on the number of new and really novel antibiotics meeting the public health needs on the market within a certain time period, for example. So I think it's promising. I look forward to both through the EU, but also as Sweden collaborate with the US and globally partnering with both institutions and countries to really strive for ambitious commitments in the political declaration of next year.
Wonderful. We certainly need that.
Yeah.
Thanks. We have a question. Please introduce yourself and go ahead and direct your question if it's to.
Is it live?
Yes.
Yes, okay. Hi, my name is Erin Duffy, and I'm with Carbex. We're a global implementing partner of BARDA in the early development space for antimicrobial products. And I just wanted to touch on two topics that I've heard throughout this and give a little perspective that we've seen. And the first is the number of products in the development pipeline today. So since 2017 from Carbex, we've put 13 treatment and prevention products into human clinical trials and 9 remain active. And while that number may sound large, in fact, there's almost no overlap among them in terms of the syndromes and the pathogens that cause them that they target. And I think that's really important because as we move these and we understand attrition, it'd be great if they make it through to a point where we have them on the market. But I think it would be foolish to think that they alone are enough. And so I think that's comment number one. Related to that is that only one of those products of the 9 that are active can be considered a traditional small molecule antibiotic. And so we've talked a lot about innovation and novelty, and those are wonderful, and certainly we need those for resistance. But one thing that we haven't talked about today is what is needed to take them through to approval by a regulatory body. And this is an area of serious global interaction and collaboration that is just starting to happen. I see our colleague Michael Craig here from the CDC. Michael took a leadership position last year in concert with the FDA to encourage a conversation, a global conversation around meaningful endpoints. And I think we need to do this if we're going to see these novel products really come through. The second thing, and this is a more positive thing I think that I'd like to end on, and this goes back to the earlier conversation about what we may take away and enhance in lessons from COVID. So this year we had an omnibus solicitation with 3 distinct funding themes, all meant to bring products focused on the global need. I'd like to say that in those 3 themes, which are actually pretty narrow in their focus, we had about 240 unique global expressions of interest to these calls. And so the innovation is out there. And of those, importantly, nearly 100 of these were diagnostic developers who brought COVID products from every level of the healthcare system, from reflex tests at the highest level down to true point-of-care tests and everything in between. And I think we need to capitalize on these before we lose them. They're out there, and we need to work with them. So thank you.
Great, thank you so much. Fantastic to hear about some of the work that partners here have also supported. It sounds like we've got a growing early stage pipeline, which is fantastic to hear about. Some questions, of course, of how do you push that through to late stage development, regulatory review, and authorization. Anybody want to take that perspective? How should we think about regulation in the context of access and accelerating R&D?
Yeah, I mean, I can take that too. I mean, we work very closely with the FDA in really mostly I would say a product agnostic manner in which we talk about regulatory challenges for the development of new innovative technologies that really don't have a well-worn path towards regulatory approval. So we try to identify what are going to be the significant challenges, or even I would say the opportunities in the development of these novel, innovative, new types of technologies that are being developed by organizations like CARB-X that are going to advance into the clinical development pipeline of BARDA, for example. At BARDA, we have a significant number of subject matter experts who have spent, most of their career in drug development in the industry, and then they come to BARDA and they share their expertise with us and also with the companies that they work with. They participate in all the conversations that we have with the FDA. They are looking at lots of different and sitting on the development programs for lots of different products, lots of different innovative products. They're hearing what the FDA is saying across the board with regard to challenges, regulatory challenges for the development of these products, and they can use that collective wisdom to be able to, inform our product developers. Not about any specific product, but just in general. These are the things that the FDA is looking for. These are the data sets that the FDA is going to need. These are the clinical endpoints that the FDA is going to want. And being able to communicate that back and articulate that back to our developers helps to kind of, I would say, minimize the risk. It doesn't reduce the risk to zero, but I would say it reduces the risk of technical and scientific failure, because we're working in concert as, between us, BARDA as a funder, our industry partners, the developers, and then a regulatory agency. So we're all talking together, we're all working together to ensure that we are, identifying risks as early as possible and trying to mitigate those risks before they become, issues that just can't be solved. So that's one of the ways that we do it.
Please. Very short comment. I think I really agree that the regulatory aspects are so important and maybe a bit invisible in this. So I would also just like to mention that during the last week of the Swedish EU presidency, the Swedish Medical Products Agency will actually hold a meeting inviting regulatory agencies from around the world for a best practice sharing and experience sharing. And this is aimed to also launch a global network of regulatory agencies. FDA is of course invited, and I hope they will participate. So this could be one way, and I do think that there's also probably a need to increase the engagement of many of these regulatory agencies in different parts of the world. So this is something that might contribute a little bit to this also.
For sure. Wolfgang, anything you'd like to add to that?
Yeah, just one point. I mean, we have seen now in the COVID pandemic, it's possible that regulatory agencies work together very closely and also discuss what the colleague said, for example, endpoints, and agree on certain schemes. So why should it not be possible for novel antimicrobials or antibiotics? We talk to many companies that come to us and say, we have something good in the pipeline. We don't know how to go into clinical trials. Normally, they would talk also to the European Medicines Agency. But at the end of the day, I think it's very important that the leading regulatory agencies sit down and develop a concept on how to do that. In particular, when we're talking about very scarce products that might not end up anywhere very far in the clinical trials. So a big plea for that.
Excellent. There's much more we could delve into. Unfortunately, we've run out of time. I'd love to thank our speakers in this second panel, Dr. Chris Houchens from BARDA, Dr. Wolfgang Philipp from HERA, and Ambassador and Dr. Malin Grape from the Swedish Ambassador for AMR. Thanks for your wonderful insights. I think I leave here certainly optimistic in terms of the state of the science, the ability that we can continue to invest. Clearly, we're increasing the tools we have in our arsenal, whether it's on the technical side with the early pipeline or on the collaborative side and testing out new models of public-private partnership, as well as really thinking about the financial innovation that's really going to be necessary to create sustainable markets and global access. It's also quite clear that for us to make real progress, we're going to need much more coordinated, comprehensive approaches that really look from R&D all the way to access and stewardship. So I thank all of you for participating and really for your leadership in moving this important field forward. With that, I'll thank everybody for joining us and hand back over to Steve Morrison to close the overall session. Thank you.
Thanks, everyone. It's been a rich morning. I think Krishna did a terrific job of summarizing what we heard today. We came together with the thought that the Transatlantic Alliance provides a very important mechanism and a lens for looking at this problem, and I think we've confirmed that. There's a lot of common purpose, a lot of muscle and capacity, common frameworks, and we know the trick now is really to try and get to higher level political leadership committed to this, to reach publics better through communications, to have a much stronger coordination and metrics and accountability for performance, and to reach beyond the Transatlantic Alliance to the broader community of states. I was very encouraged by what was said about thinking bigger in terms of R&D to platforms, reaching beyond small molecules, taking the lessons from COVID and applying those here. And I think we're going to have a lot more to think about as we look downstream 14, 15 months to the 2024 AMR high-level meeting, which I would assume many of the ideas and challenges we've talked about this morning are going to figure in the deliberations leading up to that and the preparations in trying to set goals as we look forward. So thank you all for being with us here. In person, remote, and special thanks to all of the presenters on the two panels and to Julie Gerberding and Krishna Udayakumar, and we're really grateful. We'll be posting the video shortly with a transcript, and so please look for that. The Director General for Health and Food Safety, Sandra Galina, has recorded a message for us, which we will incorporate into that product, which you'll see as we post it. So thank you, and we're adjourned.